CAR T cell resistance is it's a real phenomenon. We don't, I would say that we don't have a way really to mitigate the CAR T cell resistance at the current time, other than probably most likely doing it in patients that have early relapse or earlier lines of therapy. I think with earlier lines of therapy, the T cells are perhaps going to be less exhausted, and also the immunosuppressive cells, the Tregs, the Bregs, the MDSCs, I think will be less abundant in the bone marrow in patients that have earlier lines of therapy. What we don't know, and what would be something that we're all trying to figure out, is are there therapies that we can give going into CAR T cell therapy that potentially would prime the bone marrow to a better position so that patients actually will have a better response to CAR T cell therapy? We also are noting that after CAR T cell therapy, there is this clonal escape of cells that basically are BCMA negative. We now are starting to find a small percentage of patients that are actually BCMA negative. We're also in the bispecific space finding patients that actually have mutations in BCMA, and so that the antigen on BCMA that the antibody is targeted against, there's a mutation in that region, and thus the antibody no longer binds. These are investigations that we need more of, and we need to really figure it out. One of the things that might help also is to do combinations of therapies. And so maybe we actually need to do CAR T cell therapy and do a short course of maintenance therapy. Maybe if we had a cell mod and we can use that either before, during, or after CAR T cell therapy, or we can do maintenance with a bispecific targeting a different antigen like talquetamab after a BCMA CAR T cell therapy. These are strategies that we've all been thinking about and considering to try to mitigate problems with resistance. But it's a real deal, and I think one of the biggest developments in the next 1 to 5 years will be figuring out that issue and trying to actually make it so that CARs actually they last longer, and basically that we're not developing this this resistance to a certain target on the cell surface.